In this video learning module, we'll talk about how to perform specific personal care activities for your loved one. You'll also learn what to keep an eye on and to make observations about your loved one as you assist him or her. And you'll learn about skincare and why it's important for the older adult, how to ensure that your loved one's skin stays healthy, and you'll be able to recognize and report skincare problems appropriately. Personal care and grooming refers to the things we do every day to make ourselves look and feel good and stay healthy and clean. This includes bathing or showering, hair care, shaving, mouth care, nail care, getting dressed, skin care, and taking medications. Most of these activities are done in private, without assistance, so when a loved one can't do them alone anymore, it's frustrating. Imagine if someone came to your room as you were waking up to wash your face with soap you didn't like, brush your teeth without your favorite toothpaste, comb and style your hair all puffy when you like it smooth, and put clothes on you that you don't like. You'd be frustrated too. That's why it's so important to help your loved one complete these activities with dignity and give them the opportunity to make as many decisions about their personal care as possible. Of course, if your loved one has symptoms of dementia or isn't feeling well, you might need to use your discretion and limit some choices. Let your loved one's condition and mood guide you on any given day, and remember that your loved one will appreciate being able to keep some control over such personal activities. Before we talk about the tasks, let's go over a few general rules for personal care and grooming for your loved one. First and foremost, safety first. Never put your loved one or yourself in a dangerous situation. Determine what supplies you need and make sure they're all within reach. You don't want to leave your loved one unattended. Be patient with timing and never rush your loved one. Doing too much at one time could exhaust them and make him or her unable to stand. Also, be patient with your explanations of what you're doing. Keep his or her dignity in mind. Their personal care might be a work task for you, but for them it's what helps them look and feel their best, and all people want to look and feel their best. And finally, when you're finished, return the area to its original condition. Now you know the general rules, let's get into the tasks. Bathing or showering is a very personal and private activity. When assisting your loved one, kindly acknowledge that you understand and always give him or her as much privacy as safely possible. On days where a full bath or shower is not scheduled, you will need to assist your loved one with washing his or her face, neck, arms, and upper body. Start by gathering the necessary items: towels and washcloths, soap and toiletries like deodorant, lotion, shampoo and conditioner, and a robe and slippers. Also get a bath mat for outside the tub and a towel or rubber mat for inside the tub for safety. Make the environment comfortable by keeping the bathroom warm and free of drafts. Take care to prevent burns by running warm, not hot water. 105 to 110 degrees is ideal. Test the temperature with the back of your wrist and let your loved one test the water as well. Your warm may be too warm for them. Help your loved one undress and always assist your loved one in and out of the tub or shower slowly and with both hands. Ask your loved one to use safety rails if they're available. During the bath or shower, allow your loved one to do as much as possible, but if you need to, help them reach and wash their back, lower legs, and feet. He or she might also need you to wash their hair. Just be sure to rinse until the water runs clear and don't get soap in your loved one's eyes. We'll talk more about hair care later in this video. Help your loved one out of the tub and place a towel around him or her for warmth. If they need help drying off, pat the skin dry, never rub, and apply body lotion to elbows, hands, legs, and feet in a downward direction. Again, always respect your loved one's privacy. Help them put on a bathrobe and prepare for the next step in the daily grooming process. Bath time is also a good time to note anything unusual with your loved one's skin condition. Skin is the largest organ in the body and is the primary defense against infection. Skin breakdown is the loss of skin in an area caused by prolonged pressure or rubbing over any part of the body, which inhibits blood flow to the skin. If it continues, the skin cells die, and if left untreated, an open sore will develop. Severe sores are called bed sores or decubitus ulcers. In older adults, limited mobility and inactivity can slow circulation. Decreased ability to sense heat, cold, or pain can also lead to skin breakdown. And of course, skin exposure to moisture caused by incontinence will also cause skin breakdown. Record any changes you notice. Is the skin pale, flushed? Does it have a bluish or yellowish tint? Is it blotchy? Does it feel dry, moist, hot, cold, or scaly? Do you see any new markings like cuts, bruises, rashes, redness, scrapes, or scratches? Is there any drainage or swelling? Here are just a few ways you can help your loved one's skin stay healthy and comfortable. Pay close attention to your loved one's food intake and promote good nutrition by preparing well-balanced meals. Offer your loved one plenty of fluids such as water and juice to keep the skin hydrated. If you see signs of a rash like red skin, itchiness, scratching, or raised red bumps, report it to a healthcare professional. Try to identify the cause of the rash and eliminate the source. It can be anything, including clothing, laundry detergent, new soap or toiletries, certain foods, and medications. Keep the area dry and discourage your loved one from scratching. If your loved one sits for long periods of time but is able to stand, have him or her do so for a few minutes each hour. If he or she can walk a short distance, even better. A little activity will take pressure off the buttocks and tailbone and allow for adequate circulation. If your loved one uses a gel seat cushion, place it in the chair as far back as possible. Shaving is a very important part of personal grooming, especially for men, though you may need to assist a woman with shaving her underarms and legs or even with facial hair. Always allow your loved one to do as much of the shaving as safely possible and try to accommodate their normal routine. Some individuals shave standing up, sitting on the toilet, or on a sturdy chair. Just be sure to position the mirror so they can see easily. Again, gather the items you'll need: a towel and washcloth, a safety razor, shaving cream and aftershave if the loved one requests it, a mirror, and disposable gloves for your own protection. Fill the sink with warm water and help your loved one wash his or her face with soap, then rinse and dry. Apply shaving cream to the entire area to be shaved. Again, allow your loved one to do as much as possible, but if you need to help, shave in downward strokes on the cheeks, upper lip, and along the jawline. Rinse the razor after every stroke. Shave in upward strokes on the neck, under the chin, under the lower lip, and on the underarms and legs for women. Wipe off any remaining shaving cream with a washcloth and apply aftershave if your loved one wants it. If your loved one uses an electric razor, you won't need shaving cream or a sink full of water. Allow your loved one to shave himself, guiding him to any missed areas, and wash off with a warm, wet washcloth. If a cut should occur, apply pressure to the cut with a dry cloth or tissue. Excellent mouth care is important to your loved one's health. Brushing or denture care should be done in the morning, before bed, and after each meal. Most people will be able to brush their teeth with little assistance. Gather the items your loved one will need, including a toothbrush, toothpaste, dental floss, a towel, mouthwash, and a cup and denture cleaner for dentures if needed. You can help by opening tubes and bottles and handing them anything they need. If your loved one cannot reach sections of his or her teeth, assist as required. Remember to wear disposable gloves if you are actually brushing your loved one's teeth. During this task, make sure you check for anything unusual like odor, sores, redness, a dry tongue or lips, missing teeth, poorly fitting dentures, or any obvious pain. If washing dentures, place a hand towel in the sink before beginning. If you drop the dentures, this may prevent damage. Nail care includes soaking, cleaning, and shaping your loved one's nails as needed. It's always safer to leave the cutting to a podiatrist or healthcare professional. Note any unusual color, thickness, or markings. Gather a towel and wash basin, an emery board or a nail file, an orange stick if one is available, and lotion. Fill the basin with warm water, about 105 to 110 degrees, and place it on the floor to soak your loved one's feet or on a stable, level surface to soak your loved one's hands. Soak the hands or feet for 5 minutes to soften the nails, then dry thoroughly. Gently clean under the nails using the orange stick or file. Use the orange stick to push back the cuticle. File and shape the nails, then apply lotion when you're finished. Hair care is sometimes the most important routine in a person's day, especially for the ladies. Your loved one could request a shampoo and conditioning in the shower, which we talked about earlier, or they may ask for help washing their hair in the bathroom or kitchen sink. They may ask for help combing and styling their hair, which should be done every day, or they may want to go to the salon. No matter what your loved one needs, comb out all tangles before washing hair. Check the water temperature on the back of your wrist before wetting the hair. If washing hair in the sink, be sure to have a large glass or pitcher to rinse the soap out of your loved one's hair. Use a washcloth to help protect your loved one's eyes and ears while rinsing the hair. Some kitchen sinks have a nozzle hose attachment that you can use. Use a towel to remove excess water. If you use a hairdryer, be sure to keep it moving to avoid burning your loved one's skin. Use the low setting if it's an option. Style your loved one's hair according to his or her instructions. If using hairspray, be sure to cover the eyes. A person's clothes are a form of self-expression, so allow your loved one to make as many decisions as possible and provide as much privacy as possible. Gather all clothing items, including shoes, slippers, and any accessories like belts, jewelry, or scarves. Allow your loved one to pick out what he or she wants. Make sure the clothes are neat and clean. Assist as needed, starting dressing or undressing with the upper body. If your loved one has a weak side, begin on the weaker side of the body. If clothes will be worn again, put them away neatly. If the clothes are soiled, put them in the clothes hamper or other designated laundry area. Help your female loved one with her makeup if she requests it. And of course, everyone likes to be told they look nice. Compliment your loved one and encourage him or her to dress well each day. If your loved one wears Ted hose, which are a special kind of snug-fitting stocking worn to help improve circulation in the lower legs, they may need help putting them on or taking them off. To help put them on, wash your hands. Check the skin on the leg and report any red areas or scratches to a healthcare professional. Do not apply the stockings unless a healthcare professional tells you it's okay. Gather up the stocking and gently apply it over the foot. Continue to pull it up over the leg until the stocking is fully extended. The foot end of the stocking must extend just beyond the end of the toes. Smooth the stocking to remove any wrinkles, making sure it's not bunched up or folded in any spots along the leg or toes. Only remove stockings according to a healthcare professional's orders. Do not rub or massage the leg. Check the skin for redness or abrasions. Note any swelling or if the leg feels warm to the touch. Also note if your loved one complains of pain or discomfort with the stockings on, and note any of these observations to the healthcare professional. Your loved one may need reminders to take medication, and they may also need monitoring to ensure that they take it. It's one of the most important responsibilities. If your loved one refuses to take the medication, you must notify a healthcare professional. Here are a few tips for completing a medication reminder. Have a glass of water available. Open the lid of the dispenser for the correct day and time. Place the medications in your loved one's hands. Be sure to watch your loved one take the medication. Here are the most common medications. Insulin is stored in the refrigerator and must be injected 20 minutes before eating breakfast. If your loved one has different instructions, follow those. If your loved one has taken his or her insulin and is unable to eat, notify the healthcare professional immediately, as this can lead to a serious medical emergency. An eye drop dispenser will make it much easier for your loved one to self-administer eye drops by himself or herself. Some people will have difficulty controlling their bladder and/or bowels, which is referred to as incontinence. Incontinence may be the result of the normal aging process, diet, medication, disease, or a combination of several of these reasons. Whatever the cause, incontinence is very embarrassing for your loved one. Always be sensitive to your loved one's feelings and never make them feel like a baby. Your loved one did not choose to be incontinent. Ideally, you can help your loved one avoid incontinence by getting to know his or her elimination patterns, including frequency, time, and special considerations. Take them to the bathroom frequently. Don't wait until they feel they have to go. Avoid serving foods that cause loose stools. If an accident occurs, it's your responsibility to help maintain good personal care. Cleanliness of the genital area after an accident is critical, as is using good infection control procedures to protect you and your loved one from infection. When assisting a loved one with disposable undergarments, gather all supplies, including disposable gloves, tissues or pre-moistened towelettes, a clean, wet washcloth, waterproof pads, a plastic bag and tie, body lotion or zinc oxide, and a pair of clean, disposable undergarments. With your loved one lying down or sitting on the toilet, put on gloves and remove the soiled garments and undergarments. Remember to maintain your loved one's privacy as much as possible. Dispose of soiled disposable undergarments in the plastic bag. Using tissues or towelettes, wipe the soiled area thoroughly to remove any solid matter. Change tissues frequently, placing the soiled ones in the plastic bag. Using the clean, wet washcloth, gently wipe the genital area first and then the buttocks. Never wipe the genital area after wiping the buttocks with the same washcloth. Doing so can result in bladder infections, particularly with females. Dry the affected areas by patting gently and observe for any skin breakdown. Apply lotion to the buttocks, lower abdomen, and inner thighs. Remove soiled gloves and put new gloves on. Assist your loved one with his or her clean undergarments and help them get dressed again. Dispose of the soiled items as follows. Remove soiled non-disposable undergarments with a gloved hand. If possible, wash the soiled articles, including the washcloth, immediately. If it's not possible, place the soiled articles in a separate plastic bag for washing at a later time and label the bag. Tie the plastic bag with all the disposable items and place it in a covered garbage can outside. Notify a healthcare professional if you notice skin breakdown or a rash. And with that, we've covered the basics of personal care. No matter how much or how little help your loved one needs, please remember that your kindness, understanding, and discretion will mean the world to your loved one. Your loved one may be reluctant to have family perform personal care for them. It's always helpful to have resources like LifeStyle options to provide a caregiver to perform these duties. Rest assured, LifeStyle Options conducts extensive training in personal care and person-centered care to all staff, so you know your loved one will receive the best care. For more information, call us at 888-342-4636 or visit our website at www.lifestyleoptions.com.